Thank you, everybody, for coming this evening. Good evening. Hello. 20 years ago, I saw a problem. And the problem was that every Western healthcare system was focused on sick care because the only interactions that people had with the healthcare system was when they were sick. And as a result, healthcare costs were escalating, quality of life was decreasing, and I believed we had to reverse this. So I went a quest to find the leading company in prevention and discovered Shaklee, a then 50-year-old brand whose mission was to keep people healthy so they could live younger longer. And our founder, Dr. Shaklee, was way ahead of his time. He invented the multivitamin in the United States more than 110 years ago and developed the first plant-based protein supplement in the world. And on your table tonight, you have a new next-generation sparkling protein with 40 grams of protein. Try it. Enjoy it. We have built a community marketing model where we have 2 million people around the world that share information, share clinically proven solutions, and support others in their health journey. And today, the need for healthcare reform is greater than ever. The United States spends more on healthcare in terms of absolute dollars and as a percentage of our GDP than any other country in the world, and yet we rank 183rd out of 183, dead last in the ratio of the amount of healthy active years to the total number of years that you live, which means we spend the most on healthcare and we're the sickest. And we can change that. And there are case studies at scale of a different model of healthcare. One of them is Shaklee. We've spent more than $500 million on research and development and clinical studies to show that living younger longer is actually possible. And we commissioned the landmark health studies with the University of California, Berkeley School of Public Health, which is one of the more important long-term studies to show the benefit potential of a healthier outcome. So we studied people who took Shaklee products for between 20 and 40 years and then tracked them for another decade and compare them with people who took other products. And the Shaklee population had 36% better indicators of heart and brain health, 59% lower rates of CRP, which is a marker for inflammation, superior disease health outcomes, up to 73% lower reduction in diabetes in the population, and up to 97% lower use of prescription medications. So that's a lot of statistics. But more importantly, these are a group of people living in different geographies, different demographics, different ethnic and racial profiles, all showing that they can be empowered to live profoundly healthier. So change is possible, and my dream all along is to help not just people live longer, but to live younger longer, and that's what it means to live age-free. And right now, as said earlier, we are at the right moment to shift this tide. Okay, we can develop the right public policies, we can provide education, and we can provide access. And tonight's panel is an amazing group of leaders in this field, in the wellness space, who have done in research and communication, are getting the message out of an alternative way to live a healthier and better life. And so I'm really proud and honored to turn over the rest of the evening to one of the most respected journalists in health, Time Senior Health Correspondent, Alice Park.